Hi, it's This Week in Psychiatric Nursing from PsychWise. I'm Cassie Powers. I'm a psychiatric nurse practitioner in Portland, Maine. Each week, I bring you a brief summary of news, policy updates, and research findings that affect the work we do in behavioral health nursing. Let's get into this week's report. Quick reminder, this video is for educational purposes only. It's not medical advice. Today is July 24th, 2026. Here's what we're covering. I'd like to start with looking at the study that examines whether medical cannabis can be helpful for agitation in dementia. Then I'd like to take a look at the review for Centanafadine, a new treatment for ADHD, and a piece on Medicaid and SNAP and how those cuts may be influencing mental illness. And finally, an FDA request for public comment on the therapeutic use of psychedelic drugs. Let's start with the research on medical cannabis for agitation and dementia. The New York Times reports on a clinical trial funded by the NIH. The study takes a look at whether medical cannabis could treat agitation in people with advanced dementia. The findings show that a combination of THC and CBD did ease symptoms in 84% of those receiving the treatment. And less than a quarter of those who received a placebo showed improvement. So pretty significant finding there. But the limitations with this study are that it has not yet been peer-reviewed or published. Current common treatments include antipsychotics, anti-anxiety drugs, opioids. We know that these come with potential side effects that can be very risky for this population. So this is an important finding for behavioral health nurses because agitation affects nearly half of the people with advanced dementia, and nurses are on the front lines of treating and managing the dementia on medical floors. Let's move on to the question of whether the FDA will approve Centanafadine for the treatment of ADHD. So this decision is due today. As of this recording, it wasn't public yet. So it's been under priority review since January. And this is a unique treatment because it targets 3 neurotransmitters. It is a medication for the treatment of ADHD in all ages, and it's a novel norepinephrine, dopamine, and serotonin reuptake inhibitor. 4 pivotal phase 3 clinical trials have been conducted looking at the efficacy and safety of this medication across patient populations. And again, it's notable that this is a non-controlled treatment option, and we don't have many of those. And it might be especially important for behavioral health nurses who work in rural settings with a rural population who may not have as much access to psychiatry, who perhaps receive psychiatric services from their primary care provider. Let's move on to an opinion piece that looks at the connection between Medicaid and SNAP cuts and mental illness. So this piece looked at food insecurity and serious mental illness and looked at research that shows an established bidirectional relationship between the two. So this author highlighted research that shows that food insecurity leads to more acute care visits, including mental health emergency care. It notes that SNAP aids more than 42 million Americans. That's about 1 in 8, and 3/4 of those recipients are the elderly, disabled, or children. And the changes were driven by the One Big Beautiful Bill Act, which aims to cut $186 billion over 10 years. So these cuts were a part of that bill. And this is especially relevant for nurses who work in public health and may work with patients who receive these benefits or have lost these benefits recently. So we know that nutritional status and access to food is one of the 5 pillars of the social determinants of health, a major factor in prevention of all mental illness. Meanwhile, adjacent to those cuts, we also have seen an increase in spending for lobbying for psychiatry and psychology. It's leapt over 30% in the last decade. So this figure comes from a study published this month in the Journal of American Medical Association Psychiatry, in which researchers found that lobbyists in mental health fields are outspending other healthcare providers to lobby policymakers. One theory about why this is happening is the increase in hospitalization for mental health reasons, especially among youth. Perhaps that is what's driving this increase in lobbying. Finally, I did want to draw your attention to the FDA call for public comment on the potential future therapeutic use of psychedelic drugs in supervised and supportive settings. This is your chance as a behavioral health nurse to share your opinion and voice in this process. So what are the key takeaways here from today? We looked at a study that examines how medical cannabis may be a new treatment for agitation in dementia. We are waiting to hear about Centanafadine and whether it will be approved. And we looked at an editorial regarding Medicaid and SNAP cuts and their role in worsening hunger and mental illness. And I wanted to highlight an opportunity to share your voice about the therapeutic use of psychedelic drugs. That is it for today. Thank you so much for being here. That's it for this week in Psychiatric Nursing from PsychWise. Please be sure to follow along for weekly updates, share this with a nurse in your life, and please feel free to leave comments and questions below, especially if there's a topic you'd like me to tackle for next time. Thanks for being here.